All week long, we are bringing you the latest on the devastating effects of Obamacare. And today, we have a special guest with us here. She is actually, her breast cancer is in remission. Fantastic news. But you say, if you were diagnosed a year from now, your story might be different based on the care that is going to be provided by Obamacare, correct?
Well, they really will. Obamacare takes a disproportionate hit on cancer patients. And if you look at breast cancer, 1 out of 8 women diagnosed with it in our lifetime, but we have the longest survival rates and the earliest diagnosis rates because of mammogram. Well, Obamacare has panels and task forces which have changed the very recommendations.
This is the scary part, okay? So we're going to look at what's happening with mammograms here and the changes that are going to take place. It hits me hard. We have a family of breast cancer. Every woman in my family's had it. It's probably going to come my way, so I'm a little heated about this. Talk about the changes, the restrictions now.
Well, traditionally, the American Cancer Society and the standard of care has been to have a mammogram every year starting at age 40. Well, this task force came in without a single breast cancer specialist on it and said, don't even start your mammograms till age 50, and then every other year until 74 and then stop. What's really surprising is that a study recently showed that these younger women have a higher death rate. These are young women who have kids at home, they're active professionally, and particularly African American women are the most commonly hit in this young age group, and they're more likely to die of breast cancer. And now we have recommendations not even to get the mammograms when we know that delaying your diagnosis increases your chances of dying from cancer.
Absolutely. All we hear is early diagnosis saves lives. Find it early, live longer.
Exactly.
So we're talking about restriction on the mammogram screenings and at age 74. I mean, you're 75 years old. Even if you've had a history, how can this be?
What does that tell you? They don't even want to know because I guess they don't want to spend the money then to go ahead and treat you. So we're going to see our mothers and grandmothers showing up with late-stage disease. And if you diagnose it earlier, your chances of having breast-sparing procedures are far greater.
Exactly, and then it'd be metastasizing and going into other areas of the body. Delayed diagnosis and doctor shortage. Can you tell us a little bit about those?
Well, the way that Obamacare is structured, it's really based on perverse incentives, where there's a certain amount of money and the hospitals and the doctors are able to keep more of the money by withholding care. And what's really sad is that the selective delays, particularly for cancer patients, are very ominous. They recently delayed the cap on out-of-pocket expenses. So chemotherapy agents, cancer drugs, are very, very expensive. And now there's no limit on the out-of-pocket expenses.
And now the limitations in terms of the actual treatments and payments, I mean, this seems like an atrocity. We have a doctor shortage coming ahead of us, right?
Yes.
Cancer treatment limitations. And then also, did I hear correctly, there was no breast cancer specialist on the panel that made all these changes?
Exactly. And this is what is so sad. We are really at a turning point in the time of cancer. We're looking for a cure. And instead of being able to go to the specialists that we want to go to, we're restricted to a very limited number of doctors and hospitals. And it becomes more about cost savings than life savings. And we also have a problem with failing to be able to recruit the best and brightest into medicine now that would come up with the cure. We're taxing innovation. We're delaying technology. We're giving money to hospitals and taking away from drug developers. And all of these things would give those of us with cancer hope for an actual cure. But instead of doing that, Obamacare is limiting all the things that would lead us to go ahead and beat this disease that affects so many in our country.
Dr. Kris, I want to thank you for being with us today. It's certainly a battle cry, and look, I hope that we can look at more women like you with success stories in their health, but with this plan ahead, it doesn't look that bright.
Well, you've got to fix it. Thank you.
We can. Work to do. Hey, come